Let me just say this at the outset so that YouTube doesn't take this clip off, or social media doesn't clamp down on us at the behest of the Biden administration. I'm not against vaccines. I've said this on the program many, many times. But what I am for is people making their own decisions. I am against government mandates. And I'm concerned that we're not getting the full picture, all of the information. And here's why. There's a new study out of Israel that shows that natural immunity is 13 times stronger than the vaccine in combating the Delta variant of COVID. All right. So we're getting these breakthrough cases of people who have actually had the vaccine, but then they get the virus. But then there's people who've had the virus and they have a greater level of protection against it. But the federal government is not even talking about that. There's not even a discussion about natural immunity. Why? Well, joining me now to talk about this is Dr. Marty Makary. He is at Johns Hopkins University School of Medicine. He's a physician and a professor, and we've had him on many times, and I'm glad to welcome him back. Dr. Makary, welcome back to Washington Watch.
Good to be with you, Tony.
All right, let's jump right into it. This study out of Israel that shows that natural immunity has a stronger level of protection than the vaccine in some cases. Is this a legitimate study?
It's an incredible study. It had over 700,000 people, really sound scientific methodology, and it shows just what you said in your introduction. I agree with everything. It is not only 13 times better than vaccinated immunity, but natural immunity, when you adjust for the differences in the populations that were studied, is as much as 27 times more protective. And most importantly, no one died who had natural immunity. Now, also, no one died who had vaccinated immunity. So we got to be honest with the public. Breakthrough infections are not our battle. It is protection against death and disability. And if we listened to these results instead of dismissing them, we could focus our efforts with intense laser focus on non-immune adults, those who have not been vaccinated and those who don't have natural immunity. Those are the folks we really want to get vaccinated, and they should go get vaccinated quickly as Delta spreads. But when they disregard these studies, they're hurting the credibility with the public, and they're hurting our vaccination efforts.
So if we focus, like you said, on those that, number one, are at risk, those who are not those who have no immunity, would we not get, if we focused on that, would we not to get to that level of herd immunity that we're trying to reach faster?
So Delta changed the equation a little bit on herd immunity, because we used to think there was a number and you'd see really significant slowing, and we got there in May of this year. But Delta changed the game. It's so contagious that everybody will either get vaccinated or get the virus, get infected. So we want folks to get vaccinated if they've not had the virus already.
So why does the CDC not recognize natural immunity when we're talking about, now the government requiring employees and others to have the vaccine, but making no allowances for those who have actually had the virus and have natural immunity?
It's so frustrating to see this. I think there's a lot of doctors that are looking at this and saying this is one of the greatest failures of public health in history, forcing people who are already immune to get immunized. It makes no sense. It's illogical. They've been dismissing it early on. Some say pharma has been part of the narrative. I personally think we've just got a very small few people making all the decisions medically, and they're just old school people who are just have a different opinion, and they dug into that position when it became a political position to immunize everybody. And so when people see we got to vaccinate every American, I don't agree with it, but at the same time, the nuance is we want those without natural immunity, without having had the infection, to get vaccinated if they haven't already.
See, I've said all along that if you really wanted people to get the vaccine, you should tell them they can't have it. Then they would want to get it.
If we were honest with people, we would have much better vaccine uptake, but we have not been honest as a medical establishment.
And when the government gets involved in these issues, it raises the level of suspicion and distrust, especially in the environment in which we currently find ourselves. So I just think if they could reset and go back. And I think one of the first steps would be to recognize natural immunity and also acknowledge that these vaccines are not 100% foolproof.
Yeah, can you imagine if our public health leaders said, look, we got this one wrong. We just came in with the wrong hypothesis. Natural immunity is incredibly effective. Don't go out there and just get the virus to get it, but get vaccinated if you don't have immunity already from previous COVID infection. That would do wonders. A little honesty would go a long way.
I think you are absolutely right. Dr. Marty Makary, always great to talk with you. Thanks so much for taking time to join us today.
Good to be with you, Tony. Thank you.